It's an honor and a privilege to join you today to provide some brief remarks for this Talk to the Hill and the Equal Justice Coalition's efforts to make sure that we have legal supports in the communities where we need it most. I am Michael Curry, President and CEO of the Massachusetts League of Community Health Centers, and I also wear the hat of being a member of the National NAACP Board of Directors. I chair the National Board's Advocacy and Policy Committee. I can tell you in both of those hats the critical work of lawyers in this moment. Just a few months ago, almost a year ago now, we were experiencing the beginnings of a pandemic. We saw the health inequity that displayed across the country. We're seeing that now. I call that our national Katrina. We should have known that people who lived in congested households, who lived in poverty, who were dealing with food insecurity and housing insecurity, who were homeless, who were dealing with 2+ comorbidities would be disparately impacted by a pandemic. We should have known throughout this country that it would have played out that way, like we should have known in New Orleans with Katrina. At the same time, we should have known that there was a racial division in this country that required that we pay attention to the racial injustice that is as woven into the fabric of this country as apple pie and the American flag. That the reality is that many folks who are poor, who are Black, who are brown, are disenfranchised, are mass incarcerated, are dying of higher rates of disease, do not get the same justice in our courtrooms or on our streets, and are denied an equal education. So what does that mean for us as attorneys in this moment? And what is the focus of, part of the focus of today's conversation is around the partnerships that must exist between the legal community and others, particularly health centers, hospitals, civil rights organizations, community organizations, those medical and legal partnerships that have been so critical to community health centers across the country and here in Massachusetts. I'm going to urge you to think about this moment we're in, these two, as people call them, pandemics, that has given us some awareness to these underlying issues of race and health. We need our lawyers. If we ever needed lawyers, we need them now as we deal with the immigration issues, as we see immigrant communities, due to the chilling effect caused by public charge, caused by anti-immigrant policies on the federal and many places local level, has really driven immigrant families into hiding from getting the services that they so desperately need, that quite frankly saves lives. And when you think about public health, it is in none of our best interests if any American, any citizen, any resident isn't able to access health care. So we have a challenge. We need attorneys like you who are tuned in today to be part of this movement, to contribute to the work of the Equal Justice Coalition, my friends over at Greater Boston Legal Services. We need you on the front lines around eviction. We need you on the front lines around disability rights and access. We need you on the front lines around immigration issues and making sure people have access to care, the testing, the contact tracing, now the vaccinations, that they're not denied the access that they deserve. We need you on the front lines on these public health issues, because we need you at the front door and in the health centers as we engage patients to provide them care, and then refer them to you as attorneys that can help them deal with these things we call the social determinants of health. Those factors, those things that happen outside the doors of community health centers that has Black and brown folks dying 5, 10, 15 years earlier, that relegates people to poverty and sickness and poor health. That's where we come in as attorneys. I think the pandemic has really laid bare for us the challenges that we have that, quite frankly, we inherited. But we have an opportunity in this moment as we enter a new year under a new administration in the White House with renewed commitment across the country to deal with these inequities. But we need your legal guidance. Our communities need your legal support. I'm urging you and encouraging you to find those ways as legislators that are on this call to lean in and support these organizations that are doing this critical work. I have a phrase a quote from W.E.B. Du Bois, one of the founders of the Niagara movement, which gave birth to the NAACP, when he said, "Nothing can be solved that can't be faced." Nothing can be solved that can't be faced. We are now facing the ravages, the impacts of this pandemic, the racial inequities that have been borne out over the last year, as well as the racial injustice. I speak on behalf of the 52 community health centers, over 1 million patients, and our many leaders and staff at community health centers across the state and across the country, when we ask you to lean in this moment as attorneys and be part of this moment that we hope is a movement that will change the circumstances in the communities that we all care about. So I want to say thank you to the Equal Justice Coalition. I want to say thank you to MLAC. I want to say thank you to those legislators that for the past 20 plus years have supported the work of these organizations in providing legal access. Now is not the time to take our feet off the pedal, off the gas. We now need to lean in and do the kind of work that Dr. King, as we just celebrated his life and legacy, this is the moment to address those underlying conditions that are impacting communities. So I say God bless, Godspeed, and I look forward to working with you now and into the future.